It has been a roller coaster ride, and we are not done with this ride just yet. To talk a little bit more about all of the feelings and how so many of us are trying to manage throughout the pandemic, let's bring in Dr. Melanie Schwartz. She's a licensed clinical psychologist and the owner, Viewpoint Psychology and Wellness. Doctor, thank you for being with us today.
Thank you for having me.
1 year into this, how are you doing?
I'm doing okay, but you used the right word, roller coaster ride. That seems to be the word that words that seem to come to mind when talking about the last year and ongoing into the future too.
Because it's like we go through these emotions where you get depressed, but then, something will happen or the sun will shine and you get outside and you get hopeful again. But then, it crashes as maybe someone that gets diagnosed with COVID or the surges that we continue to see. How important is it for people to take a break from all the outside influences and the talk and the chatter to try to manage their feelings during this pandemic?
Extremely important, because we're getting information from every which way, whether you're watching TV, listening to the radio, social media, your computer, wherever it's coming from, that's all we're hearing about. And it's a lot of information, and some of it's conflicting information, and it just creates a lot of anxiety. And over the last year, it's created hopelessness and depression and anxiety and anger and you name it. The emotion, the feelings, they've been there. And so taking a break is extremely important because it gives you time to just be mindful and focus on the present and not the future or the past or the last year, just being in the moment, which is really good to kind of calm down your mind.
I wonder if all those months ago, if instead of saying, hey, we're going to close things down for 2 weeks, if someone would have said, we're going to start with 2 weeks, but this could be going on in a year, if that would have impacted how some of us were dealing with our feelings and the emotions throughout the pandemic?
That's a good question. I honestly don't know, because, if somebody had said this was going to be going on a year later, that may have created a lot of hopelessness a lot earlier.
Yes, that's true.
In a lot earlier. But, we're also, again, it goes back to that roller coaster mentality of, we get our hopes up and then we're disappointed, and then we get our hopes up and then we're disappointed. And it's a constant roller coaster. I just keep using that word, but that's what it's doing for us. But at the same time, the hopelessness tends to be short-lived. While we have some hope, when they say things are getting more under control or the numbers go down for a while. So it helps us kind of pull us out of the depression, hopelessness for a little bit. Even if we go back into it, I think is better than being in it continuously.
Dr. Melanie Schwartz with us here on the MegaCast. She's a licensed clinical psychologist and the owner for Viewpoint Psychology and Wellness. We were just speaking with Dawn Kepler at Michigan State University about how some of their students are handling this that are in recovery, which can make things even more challenging. But we have so many kids here that are still struggling, even though they're back in the classroom.
Yes.
How long? They could go remote once again. So what should parents know a year into this to try to help navigate and guide their kids?
I think they just need to be aware of what to look for. I think they need to look for whether their child is isolating, whether their child is talking about feeling sad, about wanting to quit activities, extracurricular activities, if their grades are dropping, they're unmotivated, if they are noticing that they are more anxious or worried about things that they normally wouldn't be. So just being self-aware. Unfortunately, the suicide numbers have been on the increase over the past year largely. And so, watching out for symptoms of extreme depression that could lead to suicide, and making yourself aware, whether you look up the symptoms online, you talk to a professional, you talk to the people and in your child's circle, whether it's friends, parents, teachers, making sure you're staying aware of what's going on with your kids. Now more than ever.
And it could be so hard with teenagers. How do you know when they're just being teenagers and they're
Right.
moody, and when they're actually in the need of help?
Yes, this year it is extremely difficult to tell the difference between the two. And, we're seeing a lot at my practice that parents are erring more on the side of caution and bringing their kids in, even if they're unsure, just to let a professional make the determination of whether their child needs help or not. So, I guess at this point, I would probably make that recommendation. If you're concerned, talk to a professional, okay? And maybe let the professional assess your child just to determine if you're uncertain whether there is a problem or not.
Because it's better to be safe than to wait too long.
Yes, absolutely.
So what has been the impact when we're talking about parents and their kids on other kids? Like, because we rely on going to school, and the teachers are often on the first lines, sounding that alarm bell when it needs to go off. But now I feel like some of the pressure is being put on their friends to maybe be the ones that notice those changes first. And then the friends, because a lot of them are still young, they are teenagers or even 10, 11, 12-year-old. They don't know how to ask for help for a friend.
Right. To be honest, yes, teachers are often the ones who can see what's going on with the kids, but more often than not, the kids are the ones who point it out to other kids. One of my specialties is working with adolescents, and more often than not, I'll hear them talk about how they're concerned about one of their friends and what should they do and how should they handle it. And, we talk about how they can reach out to their teachers or counselors or even the parents of their friends if they feel comfortable doing that, that they should never try and handle it on their own, that they should always get assistance from an adult.
We're talking with Dr. Melanie Schwartz here with us on the MegaCast as we are a year into the pandemic, and we're hoping that we're on the backside of it with a vaccine. But we also know that there are going to be so many long-term impacts coming out of this. We're never going to go back to life like we once knew it. We can't erase COVID-19 and this past year of experiences, but we've had so much focus on the kids. What about the parents? Do you think sometimes the kids are better to adapt to change than what we are as adults?
Generally speaking, kids are more resilient than adults are, but I think, the kids, unfortunately, were hit in such an extreme way this last year that I don't know that parents versus kids who had it worse, depending on, their circumstances. Because the kids, our adults, our whole lives changed as well in one way or another, but kids, their lives were turned completely upside down. And kids really thrive on structure and being able to know what their day looks like, what their week looks like, what activities they're going to, if they have to go to their after school job or, hang out with their friends, whatever that looks like. And that was completely taken away from them. So I think they probably experienced more loss than we did. And so I think they actually is equally a difficult time, if not more.
So what are some of the coping measures that you would say could it benefit the parents and the kids to help get us through this time?
Well, I think having open dialogue and conversations about how they're feeling and what's going on for them or, just in their daily lives is very important right now. It's very easy to keep things in. We've been dealing with this for a year. And I think a lot of people, kind of think, well, what am I going to talk about? It's been the same thing for a year. It's not changing. This is just how I feel. But when you don't talk about it, then it builds up and then the symptoms increase for you. So definitely talking about it, making sure, we've been very lucky. The weather has gotten fairly nice, fairly early for us in Michigan. So making sure you're getting outside, getting sunlight, making sure you're exercising, whether you do it individually, do it as a family, do it with your friends, making sure you're still socializing, whether, you're allowed to do it in person or if it still has to be over technology, making sure that you are not isolating. These are some of the things that are really, really going to get us through.
Dr. Melanie Schwartz with us here on the MegaCast. I know that you are also a part of the West Bloomfield Police Department's peer support team. We had Kurt Lawson a couple weeks ago talking about the program, but tell us more about it and your role in the peer support program.
So my role, I've been brought on as the mental health professional for the peer support team. So my role is to be a consultant for the peer support team to the members of the team. After they speak to one of their colleagues and they feel that they need additional support, then they're going to reach out to me to see what I recommend. If I suggest that they would need additional services, therapy, or whatever they may need, and who I would recommend, where I would send them, or they may even want me to speak with one of the members of the police department as well to make my own assessment and get my own perspective. So that's my role, and also to help them with training periodically throughout the year to keep them up to date on what they need to know to help their peers.
This is so great that they're starting this program because for years, decades really, when it comes to law enforcement, there was a code of silence around mental health issues. So how important do you think it's going to be for the profession overall to start to have some of these programs?
Extremely important. I'm so glad that West Bloomfield decided to do this. These programs have gone on for years throughout the United States, even out of the country. So now that they're starting to develop in the country and Michigan, several of the departments around here do have peer support teams, which is great. I think just breaking the stigma of mental health and just being able to have someone to talk to and vent if you feel like that's what you need to do instead of keeping it all in, which is kind of the mentality of a police officer, to present as there's nothing wrong and I can handle all of this, which is not the case for anyone because everybody has things that they need to talk about and deal with. So just having that peer that you can go to is going to make a huge difference.
And getting them to open up, because we do know that suicide rates and alcoholism and substance abuse is high amongst some of our first responders.
Mm-hmm. Yes, absolutely. Those are some of the main reasons that the peer support team was developed, so that we can decrease that, increase the the physical and mental health of the department, and increase the morale and just their ability to be productive at work as well. Because, when they're not sleeping great and they're not eating and they're engaging in unhealthy coping skills, then, they're not as effective as they could be. So being able to improve their health in different ways is definitely going to make a difference for them.
So many law enforcement officers and our first responders, they see and deal with so many tragic events and situations. So it's so great that they're going to start getting this help. And let's hope that it does start to change the dialogue and people are comfortable using these services as well. Just another minute or two with you here with us. Dr. Melanie Schwartz with us. She's a licensed clinical psychologist and the owner for Viewpoint Psychology and Wellness. Hopefully, we do have more and more people are starting to get vaccinated. Unfortunately, we are also in the middle of another surge here in the state of Michigan. But as more and more people get vaccinated, do you think that people are going to be more comfortable going back out in public and out in public without a mask?
Yes, I do. I think that is everyone's hope, is that the vaccine is going to eventually, if enough people get the vaccine, that the ability to go out and do things in a safe manner with or without a mask will make a difference. It's definitely decreased anxiety for a lot of people, myself included. I've been vaccinated and I was able to go back to my office a couple days a week, which I haven't been able to do for a very long time, and feel comfortable being able to do that and see people in person. So definitely it's going to make a difference, decrease anxiety, and hopefully get people feeling like things are a little bit back to normal. Not completely, like you said, it's going to be a very, very, very long time before that happens. But I think just that feeling or little feeling of relief that you feel more safe than you did makes a huge difference.
Dr. Melanie Schwartz with us on the Oakland County MegaCast. And Dr. Schwartz, as we are getting to that point, and as we do unmask this pandemic over the course of time, as the vaccine process gets us closer to that herd immunity point, what should we be cognizant of as we do get back to some semblance of normal, whatever that is after this pandemic, and begin to socialize again and begin to go back out as we regularly did pre-pandemic? What should we be more cognizant of and respectful of when interacting with other people? Because all of us are going to come out of this at a different pace.
Yes, we are. And I think that that's it, is to do this slowly and, in a respectful way, because we don't know who's been vaccinated and hasn't been vaccinated. And we don't know we don't have a lot of answers about the vaccine yet as well. So, I know everyone wants to rush and go back to normal and everything open up and just resume life as it used to be, but then we're risking safety once again. So I think it's just slowly test out the waters, and, you have to ask questions and say, do you feel comfortable, going to a restaurant? Do you feel comfortable wearing your mask or not wearing a mask around people? Being respectful in stores where you still do have to wear a mask, and that's okay. Just be respectful of it, because everyone is at different levels of where they're at emotionally and whether they've gotten a vaccine or not. So some people are at a safer level than others too. So just take things slowly, step by step, and we'll get back there. It's just going to take some time. So patience is going to be key.
Such great advice. It's always great to have you with us here. We appreciate your expertise and your knowledge.
Thank you very much.